The practical pre-oxygenation and apneic oxygenation, I will discuss something. Pre-oxygenation with tight-fitting mask, it has to be 100% oxygen, flow around 10 to 12 liters per minute, aiming an end-tidal oxygen of more than 90%. Usually, 3-minute tidal volume breathing or 8 vital capacity breathings over 60 seconds is done there. But you can apply manually some PEEP with APL adjustment. Nasal cannula usually oxygen, usually 10-liter flow is given by nasal prongs. But what we do sometimes is we put the nasal airway, and with the International 21, we put on the nasal airway, and we connect with a Jackson-Rees corrugated tube, that with a separate oxygen cylinder to give a 10-liter baseline flow when the endoscopy is being done. This I have deliberately write HHH. That means heated, humidified, high flow nasal cannula. Although it is a new stunt in our health area now, it can significantly delay saturation, drop of saturation below 95 from 156 seconds to 261 seconds. So high concentration of oxygen may lead to resorption atelectasis, so you have to balance that whether you want to give 100% oxygen or 80% oxygen. More important is doing some recruitment maneuver and promptly start PEEP so that the atelectasis that is prevented or reversed.